continued thoughts and reflections on the International Nurses Week. Specifically at this moment, I want to make and bring to light what our nurses do in our hospitals, or rather the interaction of a nurse with our patients. First and foremost, notice that in all health care services, the nursing services are the backbone. In fact, in all the hospitals, the backbone are the nurses, or rather the nursing profession. And the well-being of a patient depends on the nursing services that are rendered towards that patient. And therefore, the nurses are a backbone and they ensure the well-being of all patients, especially in the hospital setting and those also who give care in the nursing homes. I want to state 6 responsibilities that nurses do in their everyday profession to take care of our patients. First and foremost, nurses give direct care to the patient. For example, something like hygiene, assisting in mobility. So, every care for a patient is given by a nurse. So, when you are hospitalized, the person who takes care of you is a nurse. They give close, direct care to the patients. And second, nurses continue with the assessment and monitoring, say checking on the response of the patient to the treatment, say to drugs. So they do that everyday assessment and monitoring. And that nurses communicate to the patient. They communicate to family members and persons concerned on the journey for patients' care and treatment. And number 4, the nurses also are an advocate. They speak on behalf. Sometimes the patients can't speak. They are not able to express their needs. But nurses have a way to study and to know the needs of a patient. And therefore, they are an advocate of the patients, both maybe to doctors, to special caregivers, and also to families. They are a bridge of the patient to the community and even to the doctors. And 5, nurses continue educating the patient on the recovery journey. They educate the family members and also again people who are concerned with the journey for healing, recovery, and treatment processes. And finally, it is nurses who ensure that a patient enjoys a safe recovery environment. Because health and healing need good conditions. So nurses sustain and make sure that where we place a patient is a favorable condition to make sure that this person is able to enjoy the healing process and putting away some complexes that would obstruct the healing processes. And therefore, in this week of nurses, we want to once again appreciate them, pray for them, and put them into mind. Beloved nurses, may the Almighty God give you grace and favor and blessings as you continue taking care of patients, especially in your hospitals. Thank you very much, and may God bless you all.